Sir William Osler once wrote that the trained nurse has become one of the great blessings of humanity, taking a place beside the physician and the priest. He wrote this when reinforcing the idea that nurses continue to love and care for those who are sick. While their love and care is important, so is communication in their field, because the way nurses communicate to their patients, the families, and other health professionals can directly affect the treatment of their patients. Ms. Geraldine Kalkman, a registered nurse at Beaumont Hospital Grosse Pointe who specializes in labor and delivery, began her interview by discussing how nurses communicate to doctors.
The nurse is in the room with the patient most of the day, and if they don't see the doctor till close to delivery. So it's a lot of phone conversations with the doctor, and you have to be careful. We've got into classes for electronic fetal monitoring. Everybody has to use the same terminology, so we're all on the same page.
While verbal communication is important, so is written. Many nurses have to document the overall health of their patient. On these types of documents, it is littered with all kinds of medical terminology. Along with this, it is also documented through shorthand. This allows doctors, nurses, and other health professionals to look over the chart and be able to quickly figure out what they need to concentrate on for this patient's health while they are in the room to make it the most of their time. When Kalkman spoke of communication among nurses, she introduced the idea of bedside reports, which in their facility is when the nurse on shift, along with the patient and their family, discuss any information about the patient with the nurse who has come to replace the current one. This prevents any miscommunication among the family, the patient, and between nurses, which helps keep a consistent care for the patient. Ms. Kalkman's bedside reports sound very familiar to the family-centered rounds mentioned in Aragana's study, a quality improvement project to increase nurse attendance on pediatric family-centered rounds. Aragana's study was meant to increase nurse attendance at these FCRs, where patients, their families, health professionals, and the nurses were all supposed to discuss any inquiries about the patient's health, what the daily plan was going to be in order to improve their health. And when these nurses couldn't attend these FCRs, there was much more miscommunication among nurses, and the families and patients felt unsatisfied with their care. The lack in attendance was caused, though, by many factors, such as family-centered rounds occurring when nurses were passing medications, which prevented them from attending. As a result, solutions such as scheduling FCRs before passing medication or afterwards increased attendance and improved the patient's care. While discussing with nurses before shifts is vitally important to avoiding any breakdown in communication among the staff, it is also important that the nurse documents what they've done throughout the day. When a nurse documents, she is proving that she has done her job. An example would be bedside documentation. This shows that the nurse throughout the day or throughout weeks, even months, that the information about the patient has been kept up to date and that the nurses have been doing their job from shift to shift. In this example of nursing procedures, it is shown in a list form and various shorthand throughout that the nurse has treated various wounds or any other health concerns. Next, Ms. Kalkman discussed the more formal meetings that she has at the hospital with other health professionals. An example would be they have mandatory monthly meetings, and these occur in order to communicate important information for their unit, as well as mandatory education classes for all of those on the staff. These classes show new procedures or changes in the hospital, and they are taught and made aware of. Kalkman gave the example that one of these meetings showed a new technique for dressing pressure sores that would be demonstrated to the staff. This would ensure that everyone throughout the hospital is educated and constantly learning, while also standardizing the practice so that every patient is treated equally. When specifically discussing communication between nurses and patients, Mrs. Kalkman encouraged the idea of chatting with the patient, almost like a very casual conversation. As a result, this would make the patient feel like that you have time for them. Ms. Kalkman also expressed the importance of communicating with her patients, as well as their families. She even said that patients whose families are there do so much better than those without. Kalkman's sentiments on communication agree well with Christian's thoughts in her article, The Essence of Pediatric Nursing. translating evidence to improve pediatric nursing care for children, their parents, and families. These wonderful relationships of trust are built during a delicate time in which Kalkman mentioned that the patient might feel vulnerable in a hospital setting. And the trust patients give the nurse can only come about when there is good communication. When a nurse is able to use communication within the workplace by either having good documentation, talking to the doctor, attending meetings, and also working well with other nurses in their unit, it helps create an effective way to treat patients and truly give them the best care possible.